Diseases and disorders of the lymphatic and immune system. The immune response can be underreactive or overreactive, leading to a state of disease. The factors that maintain immunological homeostasis are complex and incompletely understood. Underactive immune system are called immunodeficiencies. A suppressed immunity can result from inherited genetic defects or by acquiring viruses. Inherited immunodeficiencies, or SCID. While many inherited immunodeficiencies exist, the most serious is severe combined immunodeficiency disease, or SCID. This complex disease is caused by many different genetic defects which result in impaired B-cell and T-cell arms of the adaptive immune response. Children with this disease usually die of opportunistic infections within their first year of life unless they receive a bone marrow transplant. Such a procedure had not yet been perfected. The most famous patient was David Vedder, or the boy in the bubble, who was treated for SCID by having to live in a sterile plastic cocoon for the 12 years before his death from infection in 1984. One of the features that make bone marrow transplants work as well as they do is the proliferative capability of hematopoietic stem cells of the bone marrow. Only a small amount of bone marrow from a healthy donor is given intravenously to the recipient. It finds its own way to the bone where it populates it, eventually reconstituting the patient's immune system, which is usually destroyed beforehand by treatment with radiation or chemotherapeutic drugs. New treatments for SCID using gene therapy involve inserting non-defective genes into cells taken from the patient and giving them back, have the advantage of not needing the tissue match required for standard transplants. Although not a standard treatment, this approach holds promise, especially for those in whom standard bone marrow transplantation has failed. Acquired immunodeficiency, HIV, and AIDS. Although many viruses cause suppression of the immune system, only HIV wipes it out completely. HIV is transmitted through semen, vaginal fluids, and blood, and can be caught by risky sexual behaviors and the sharing of needles by intravenous drug users. There are sometimes, but not always, flu-like symptoms in the first 1 to 2 weeks after infection. The presence of anti-HIV antibodies indicates a positive HIV test. Because seroconversion takes different lengths of time in different individuals, multiple HIV tests are given months apart to confirm or eliminate the possibility of infection. After seroconversion, the amount of virus circulating in the blood drops and stays at a low level for several years. During this time, the levels of CD4 T cells decline steadily, until at some point the immune response is so weak that opportunistic disease and eventual death result. Treatment for the disease consists of drugs that target virally encoded proteins that are necessary for viral replications, but are absent from normal human cells. By targeting the virus itself and sparing the cells, this approach has been successful in significantly prolonging the lives of HIV-positive individuals. Overactive immune system, hypersensitivities, and autoimmune diseases. Overactive immune responses include the hypersensitivities, allergies, and inflammatory responses to non-pathogenic environmental substances. There's different types of hypersensitivity. Type 1 includes allergies and allergic asthma. Major symptoms of inhaled allergens are the nasal edema and runny nose caused by the increased vascular permeability and increased blood flow of nasal blood vessels. Immediate hypersensitivity is usually rapid and occurs within just a few minutes. Mild allergies are usually treated with antihistamines. Severe allergies that may cause anaphylactic shock, which can be fatal within 20 to 30 minutes if untreated. Epinephrine raises blood pressure and relaxes bronchial smooth muscle and is routinely used to counteract the effects of anaphylactic shock. A type 2 hypersensitivity occurs during mismatched blood transfusion and blood compatibility diseases such as erythroblastosis fetalis. Type 3 occurs with diseases such as systemic lupus erythematosus. A type 4 hypersensitivity reaction includes delayed hypersensitivity, which takes 24 to 72 hours to develop. A standard cellular immune response in which the first exposure to an antigen is called sensitization, such that on re-exposure, an immune response results. The classical test for delayed hypersensitivity is the tuberculin test for tuberculosis, where bacterial proteins from M. tuberculosis are injected into the skin. A couple of days later, a positive test, as indicated by induration, means that the patient has been exposed to the bacteria and exhibits a cellular immune response to it. Another type of delayed hypersensitivity is contact sensitivity, where substances such as the metal nickel cause a red and swollen area upon contact with the skin in an individual who was previously sensitized to the metal. Autoimmune responses. The worst cases of the immune system overreacting are autoimmune diseases in which the immune system begins to attack cells of the patient's own body, causing chronic inflammation and significant damage. The trigger for these diseases is often unknown, although environmental and genetic factors are likely involved. Treatments are usually based on resolving the symptoms using immunosuppressive and anti-inflammatory drugs. Some examples include rheumatoid arthritis and systemic erythematosus. Overall, there are more than 80 different autoimmune diseases, which are a significant health problem in the elderly. Some of the most common autoimmune diseases, the antigens that are targeting, and the resulting tissue damage. Please see the screenshot at the end for a list of autoimmune diseases and their targets. Medical specialties and procedures related to the lymphatic and immune system. Clinical immunology allergy is a medical specialty that diagnoses and treats diseases of the immune system. Skin testing for allergies is done by a clinical immunologist allergist to identify allergens and type 1 hypersensitivity. In skin testing, allergen extracts are injected into the epidermis, and a positive result of the wheal and flare response usually occurs within 30 minutes. The soft center is due to fluid leaking from the blood vessels, and the redness is caused by the increased blood flow to the area that results from the dilation of local blood vessels at the site. So, lymphatic system and immune system vocabulary. Active immunity. Active immunity is immunity developed from an individual's own immune system. Acute inflammation is inflammation occurring for a limited time period. It is rapidly developing. Adaptive immune response is relatively slow but very specific and effective immune response controlled by lymphocytes.